Good afternoon, everyone. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability. Very excited to bring you this afternoon's webinar. We're going to focus in on CCDF Fiscal Fundamentals today. And hopefully the three-day weekend wasn't too tough on everyone and you are ready for a shorter work week and learning some more about CCDF Fiscal Fundamentals. Hopefully my screen will go forward here. There it is. Thank you. All right, so before we get started, we do need to walk through the call logistics. We do hope for an interactive session as always, and we will take multiple breaks throughout the presentation to pause for questions and answers. And kind of the common note for GoToWebinar, if you used your phone to call in, you do need to enter your audio PIN number in order to be heard. So you will have to unmute your line in order to ask a question, or if you have any comments or wish to share this afternoon. And that PIN number is unique to you as the caller. And if you do have a question, you can raise your hand using the GoToWebinar dashboard, and you can also type any questions into the questions panel. Katie Watts is with us this afternoon. She's also from NICFIA, and she'll be able to help out if you have any back-end issues, like not being able to join the webinar, or if you're having difficulty downloading the handouts, you can email Katie. Her email is shown there, but it's kwatts, W-A-T-T-S, @WRMA.com. And again, this is Leanne Bryan. I'm the Program Integrity Manager here at the Subsidy Center, or National Center on Subsidy Innovation and Accountability. Just a little bit about me. I have been heavily involved in program integrity and pretty much all aspects of program integrity within CCDF for over 10 years now, and that's combining both my state experience as well as National Center experience. And also co-presenting with me this afternoon is my colleague, Anne, and I'm going to turn it over to her for an introduction.
And hello, everyone. My name is Anne Renault Avila, and I am a Senior Program Integrity Specialist with the Subsidy Center. I joined in January, and I'm also the Fiscal Subject Matter Expert on the Childcare Development Fund Program.
Thank you, Anne. And now I'm very happy to have Dr. Ellen Wheatley with us from the Office of Childcare, and she would also like to share a welcome message.
Hello, everyone, and thanks so much for joining this webinar. Unfortunately, Shannon can't be with us today, but I'm here and very happy to do this introduction. I was a state administrator for 8 years, and I have to tell you that this would have been so helpful to me when I started, and even a few years into my tenure as a state administrator. What you'll be learning today will really help you to skip by the potholes that you can fall into because you just didn't know. It will also help you to understand with greater depth what program integrity entails. It's a lot more than just finding out whether everyone that is receiving a subsidy is eligible for it. It has to do with exactly how you're spending your money and on what you've decided to spend it. So I will let them get started now with this webinar, and I hope that you learn everything that you need. Please don't hesitate to work with your, whether you're needing to work with your state or whether you're needing to work with your region, don't hesitate to give them a call. Thanks. And I'll turn it back to you.
Thank you very much, Ellen. And I also just want to mention quickly that Min Lay is also on the phone with us this afternoon. He's with the Office of Childcare and Policy Specialist there. Just in case there's any questions that come up, Min might be able to help us out with that. All right, so before we walk through the agenda, I did want to know, or just kind of set the stage here. In some of our previous program integrity webinars, we have focused mostly on fraud prevention, detection, and recovery strategies, and also We've touched on processes to identify areas of risk within the program. Improper payments, that's another key element of program integrity and internal controls that we talk a lot about. But one area that our webinars have not gone into a whole lot of detail is fiscal accountability and fiscal management. And of course, we all know, or maybe today you're going to learn more about it, the main goal of program integrity is to maximize funds so that we can serve as many children and families as possible. And for a CCDF administrator, we should probably have a basic understanding of CCDF funding and the allowable uses of CCDF. And to set that baseline for fiscal accountability, we're going to start, kind of at the beginning and what we're considering the fundamentals. So as mentioned in the OCC announcement, and for anyone that was registered for the webinar as of this morning, I sent out a reminder email with handouts. But today's webinar really is geared towards our newer CCDF administrators, either from state, territory, and maybe even a tribal grantee that's on. And also, for anyone that may want to just kind of gain a better understanding of some of those basic fiscal aspects of CCDF. So again, just kind of wanted to set the stage a little bit. But now if I move over to the agenda, we're going to start with the basics of CCDF, then move into an overview of federal funding, including funding streams as well as some of the more fiscal-related reports that are required under CCDF. Anne's going to talk through federal requirements and allowable uses of CCDF funds, as well as budget constraints and competing priorities, kind of what Ellen talked about a little bit ago. We'll finish up with some other budget considerations as well as guidance related to succession planning, another important aspect of CCDF. So just to kind of get a better idea of who's on the phone with us, quick show of hands to start. So everyone that's listening, attendees on the phone, if you could please use your GoToWebinar dashboard and raise your hand if you assist with the managing of your state CCDF budget. So again, for all of our attendees, oh good, if you help to manage your state's CCDF budget, please raise your hand. So it looks like we have about 3 so far. 1, 2, 3, 4, 5, 7, 8, 9. I see more coming up. Right, so 1, 2, wow, we have about 20. Okay, great. And I see some state administrators on there. Perfect. Maybe some fiscal managers or budget analysts. Great. Now I do also want to launch a poll here. And again, this will kind of help us kind of know as presenters how deep we need to go into the content or if we need to keep it more high level. So this question is for our CCDF administrators. How long have you been a CCDF administrator? If you could please select the response that fits you. Have you been a CCDF administrator for less than a year, 1 to 2, 3 to 5, or more than 5 years? Give you all just a few more seconds to respond to that one. All right, only 24% voted, but as I'm looking through the list here, I know that not all of you on the line are CCDF administrators. I'm going to go ahead and close this poll. And it showed, oh, let me click share so you all can see the results as well. So 22% of you that are CCDF administrators have been in that role for less than a year. Just a little bit less, 19% have been in the role for 1 to 2 years. And then 33 at 3 to 5 years and 26% more than 5 years. So it looks like we have a pretty even distribution between, less than 2 years to 3 or more. So I guess we'll just kind of go middle of the road today. And just one more poll. Oh, let me go back here. One more. Oh dear, I did not mean to do that. So sorry. one more poll here. And this is for our other state staff. So how long have you been serving in your current role? Again, just kind of get a feel for our attendees, our audience, and how we want to drive the discussion today. So for all other state staff, if you could please indicate how long you've been serving in your role. Similar responses there. All right, it looks like the voting has stopped. So I'm going to go ahead and share those results. So it looks pretty split again, but the majority of state staff on the phone do have more than 5 years experience. So maybe you can answer some of the questions that come up today. For some of you that are more experienced, that's great to have that sounding board if needed for this particular group, because there are quite a few that have less than 2 years of experience on the line today. So cool. That is all good to know. Now we're going to get back to the webinar here, back to our slides, and we're going to start with a CCDF overview. So again, this is going to be pretty high level. It may be repetitive for some of you, but for others, it might be a good refresher or maybe even to hear this for the first time. So what is the CCDF program? The CCDF program is comprised of many areas, but the three main broad and overlapping areas include childcare financial assistance, or the payments going out to providers, health and safety, and then quality improvement activities. So I'll dig into each of these for just a moment, but if we think about childcare financial assistance, for this one, I think of, the subsidy eligibility, the payment rate, and the actual CCDF payments that are going out your door to eligible CCDF providers. The activities to improve quality, there's 10 potential activities outlined in the final rule, and there's a whole variety of quality improvement activities. If I touch on a few, supporting training and professional development of the childcare workforce, implementing or enhancing your state's tiered quality rating improvement system, improving supply and quality of childcare for infants and toddlers, investing in a statewide R&R service if you don't have one in place already. And really, there's a whole list of quality improvement activities, and I only touched on a few. For health and safety, this includes requirements for providers caring for our CCDF children. There are 10 required health and safety trainings, including those related to immunizations, building and physical premises safety, administration of medication, and again, kind of the list goes on. And really, this one's also about enforcement of those health and safety requirements. So a child care licensing system will be in place to help support health and safety. And we can't exclude criminal background checks, or we can't forget about them. Criminal background checks is also an important aspect of health and safety. So all of these areas overlap. And kind of the key to what we're going to be talking about today is if there's changes made to any one of these areas, a policy change or a procedure change, it could very possibly impact one of the other areas. And we're going to dig into that concept a little bit more later in the webinar. So this slide may look familiar. It's very similar to one that's laid out in the CCDF Fundamentals PowerPoint, but this is just one example of how subsidy works. And I will walk through this pretty quickly, just kind of giving our audience again. But those CCDFs, it's all about the child's eligibility for child care services. But we're going to start our example with a parent. So a parent applies for subsidy in their state of residence. The state or territory, that CCDF lead agency, determines whether or not the child is eligible for services based on the state's rules and policies. If the child is eligible, the state or territory determines the amount of assistance that the child or children in the family are eligible to receive. And that's going to be based on a state's payment rate. Then the state or lead agency is going to issue a certificate or a voucher to the parent. The family contribution or copayment amount is determined using that same state sliding fee scale, and those family contributions are calculated based on family size and income. The parent is going to choose an eligible provider who's agreed to accept the state's payment for childcare on behalf of that parent, and then the state's going to authorize care to begin, and the child begins attending at the selected provider's location. So again, that's kind of a very simple example of how subsidy payments work. If we take a minute to talk through direct child care services, direct services are provided to eligible children based on the federal CCDF requirements. Child care services are provided using certificates, vouchers, grants or contracts, as well as by using a sliding fee scale for those family copayments. And then finally, direct child care services are prioritized for children of families with very low income, children experiencing homelessness, and children with special needs. And that one may include any vulnerable populations as defined by the lead agency. And just a quick note on this one, states do have discretion on how they choose to prioritize childcare. All right, now we start getting into the fun stuff. Federal funding overview. So this is a graphic here of the federal funding history, and I think most of us, given those polls earlier, were around when CCDBG was reauthorized in 2014, and that was a pretty big deal, to say the least. But the CCDBG Act was established almost 30 years ago, back in 1990. In 1996, the Personal Responsibility and Work Opportunity Reconciliation Act replaced aid to families with dependent children, and that's when CCDF was established. Finally, in 2016, that's when the CCDF regs were changed for the first time in 18 years. Digging into funding a little bit more, this slide shows the 3 different federal funding streams. And all of these funding streams are 100% federal funds. The blue column, that one describes the stats or the information that we chose to focus on for each of these funding streams. So I'm going to start with mandatory. Mandatory funds are available to all 50 states, DC, and the tribes. Funds are allocated to the state based on the now repealed Aid to Families with Dependent Children linked child care program. And this program was provided under the Social Security Act. So the state share is based on federal refunds received back in the 1990s. For our tribal lead agencies, a formula is used based primarily on the number of Indian children within the tribe. A state match, or MOE, maintenance of effort, is not required for mandatory funds. And also for mandatory, it does not require an appropriation by Congress. So for mandatory, allocations are based on funds appropriated under the Social Security Act. So again, an appropriation is not needed. Moving over to matching, those funds are available to all 50 states and the District of Columbia only. Allocation amounts for matching are based on the number of children under age 13 living in the state compared to the national total of children under age 13. In order for a state to receive the full allotment of federal matching funds, and that's for a particular fiscal year, the state must provide matching funds and expend its MOE funds. Matching allocations do not require an appropriation by Congress. And I will pause for questions after I'm done walking through the whole slide. For discretionary funds, they are available to states, territories, and tribes. The allocation is based on a formula that includes 3 different factors. So it's looking at the state's share of children receiving free or reduced price lunches, the state's per capita income, and the number of children in the state under age 5. A state match, or MOE, maintenance of effort, is not required in order to receive discretionary funds. However, discretionary funds cannot typically be used to replace or supplant existing state funds. One other note here about discretionary. States can, and many do, transfer up to 30% of their TANF grants to CCDF. Once those TANF funds are transferred, they're treated as discretionary CCDF funds. And these funds are authorized by CCDBG, and they do require an appropriation by Congress. So that one, I know that's even a lot for me to take in. I have to look at this one closely every time that any questions come up on these funding streams. Does anyone have any questions? I think I'll pause just for a moment. I don't see anything coming in the questions panel. I'm going to keep moving along. I don't see any questions or hands raised. So this slide references 4 commonly used and fiscal-related reports that are important for our newer state administrators to be aware of, but this is certainly not an exhaustive list of all the federal reports that are required. So if we start with the 801, that's case-level data, and that reporting form is submitted either monthly or quarterly. It includes 40 different data points, and that's all in relation to the head of household, children receiving care, as well as provider information. The Quarterly Financial Status Report, or ACF 696, that provides financial data on expenditures as well as estimates for all 3 federal funds, mandatory, matching, and discretionary. The QPR, or Quality Progress Report, asks states to describe investments to increase access to quality for children from birth to age 13. This one's annual, and the data provided is used to describe state priorities and strategies to key stakeholders. So those stakeholders may be Congress, federal and state administrators, providers, parents, as well as the public. And finally, we wanted to point out the ACF 404, or Improper Payments Report. This one documents errors and improper payments that may be occurring in the administration of CCDF, particularly with the eligibility of children, as well as the payments going out. So each state, DC and Puerto Rico, conduct case reviews on a 3-year cycle and report the findings of those. For most, it's 276 case reviews, including actions to reduce future errors or future improper payments. And if anyone would like more information about any of these reports, it's all available out on the OCC website. I don't see any questions that have been typed in. I don't see any hands raised either, so I'm going to keep on moving along. So this is our final note on federal funding streams, or our final slide. Childcare funding can be paired with other federal funding streams, and that will help to create a strong system of supports for working families. So in this particular example that we laid out, we focused in on TANF, but certainly there are a lot of federal funding streams out there. But CCDF funds can, and really are, required to be used to support TANF-eligible families. And many of those TANF parents are participating in local workforce or career development programs. So CCDF funds can also be used to support families that are in workforce programs through their local labor and employment offices. And then the final box there, some states intentionally co-locate and leverage CCDF, TANF, and WIA, Workforce Investment Act funds, workforce-funded programs to support families in a seamless manner. So again, that was just kind of one example to walk through. Maybe we can pause for questions again, or maybe we could, if there aren't any questions, and I'll pause, I'm getting ahead of myself, see if any questions or if there's any hands raised. I don't see any, it's a quiet bunch. All right, I'm gonna try to get you guys a little bit active here. So if your state does combine CCDF with other federal funding streams, I won't call on you. Please raise your hand. And I know that many of you do. This could be Head Start, Early Head Start, the Preschool Development Grant, Social or SSBG, Social Services Block Grant, SNAP, McVee. Nobody's raising their hand? Oh, yes, there they are. Great, so we have several hands raised, probably about 10 to 15. Would anyone, and I won't call on you specifically, would anyone like to share the pairings that they're doing in their state with other federal funds? And if you would like to share, I'm going to put everyone's hands down. You can go ahead and raise your hand again if you'd like to share. Oh, we have lots of hands. All right, how about, oh, hands are going down now. How about Michelle Adams in Kansas? I'm going to unmute you. Oh, you put your hand down. How about Jana Jenkins in Oklahoma? I've unmuted you. Would you like to share the federal funding streams that you pair up in Oklahoma? Oh my gosh, another hand went down. Okay, nobody wants to talk. I'll keep moving. You guys are making this very hard for me today. And actually, at this point, I'm going to be turning it over to Ann, and she's going to walk us through our next section. So Ann, I'm going to go ahead and give you the keyboard and mouse so that you can go ahead and scroll through the slides.
Great. Thank you. So today I'm going to cover the federal requirements and allowable uses of CCDF. I just want to note when we start that this particular section, Section 3, really applies to states and territories. Tribal funding is subject to different requirements. So if you have questions on this section related to tribal funding, we're happy to follow up afterwards with another call or potentially another webinar if there's enough interest. And sorry, I'm having a little technical difficulty. Leanne, did the controls come over?
I did. You want to try again, please?
Yep, sorry about this. This seems to be stuck.
Okay. So you can't advance?
No, I cannot.
Okay, sorry about that, everybody. I'll just go ahead and do the slides for you.
Okay, great. So there's 6 categories that we'll cover today, and this includes the requirements to spend money on TANF-eligible families, the requirements to spend money on quality activities that Leanne mentioned earlier, and then direct child care services. We also have limits on administration, so this includes a 5% cap on administrative funding, childcare resource and referral networks, which are a permissible use of the funds, and then priority populations, which are both required in rule to give priority to, but there's also a lot of flexibility around serving these families. Next slide, please. So for TANF-eligible families, at least 70% of your mandatory federal funds, as well as your state share of matching funds, must be spent on families who are either receiving TANF or at risk of becoming dependent on TANF. And these families must be making efforts through work activities to transition off of TANF. This is one of the very first places in federal rule that there are requirements on how you spend CCDF dollars. Next slide, please. So then the next category is quality activities. So of the aggregate funds that you receive, so of all of the mandatory matching and discretionary funds expended by your state or territory, there are requirements in federal rule on how much must be spent on quality. In the current fiscal year, at least 8% must be spent on quality. And in 2020 and beyond, 9% can be used for quality childcare activities. In addition to this, 3% has to be used for quality activities for infants and toddlers. And please note, these are just minimum levels. Lead agencies may reserve more dollars for quality activities and actually are encouraged to as well. And we'll go over later in the presentation some ways that you can increase quality care. Next slide, please. So once the previous two requirements are met from the remainder of the discretionary allotment that your lead agency receives, states and territories must spend at least 70% to fund direct child care services. So this is child care services for low-income families who are working or in training or education. Next slide. And then in rule, there's actually a 5% cap that limits how much can be spent on administration. So you can see there's 5 categories here that you can spend up to 5% of your aggregate funds. So again, all of your mandatory matching and discretionary funds on administrative costs. And I won't read through every one of these because we have quite a few, but program administration is a good example. You can spend money on salaries and benefits. Administrative services such as accounting services. And then for indirect costs, this is costs other than direct services, so you may have rent or overhead or shared expenses such as shared staffing or shared rental space that you need to pay for. So you can use your budget up to 5% to spend on these categories. Next slide, please. And then on this one, you can see there's quite a few. There's actually 12 different categories that do not count towards your 5% limit on administrative costs. And we really wanted to include this so that you could refer to this slide in the future and see different areas that don't actually go towards your limit. And again, there's 12 different examples, so I'll just throw out a few here. Resource and referral services are one is an area that you can spend money on. Training for childcare staff or improper payment processes, including an investigation and recovery of improper payments. Next slide, please. So childcare resource and referral networks, most states or territories already have these in place, and this is actually a permissible use of your funds within federal rule, and lead agencies can use their funds, their CCDF funds, to either establish a new childcare resource and referral network or to support an existing network. There is no minimum amount that has to be spent on CCR&R activities, but it's just good to know that this is an allowable use of your funds. Next slide, please. Okay, and then the last thing is priority population. So this is really, as Leanne mentioned earlier, you can really have a lot of flexibility on what you define as a priority population or a vulnerable population and how you serve them. And the idea here is that you really want to be able to get children into services in an expedited manner and help families that are vulnerable. Next slide. So the first one in rule is families facing poverty. Lead agencies must prioritize increasing access to high quality care. For people that live in areas with a significant concentration of poverty and unemployment and an insufficient number of high quality programs. So this is one of the areas that lead agencies actually must prioritize services to. Next slide. Another one is children experiencing homelessness. So if there are children experiencing homelessness that your providers are serving, you can do specific outreach to those families experiencing homelessness. You can also provide training and technical assistance for providers on how to identify and best serve those children and families. And you also have flexibility around procedures to permit enrollment for those families. So, for example, you can have grace periods for immunization or other health and safety requirements so that you can serve those families in an expedited manner and obtain that documentation afterwards. Next slide, please. And then for this last one, again, we mentioned vulnerable populations can be defined by a lead agency, and we just wanted to give some examples of how you could serve a family with special needs, with a child with special needs. So a lead agency has the discretion to waive copays or fees for the family, implement differential payment rates for providers. So if you have a provider that has to make special accommodations for a child, you can give differential payment rates to them to accommodate that family. And you could also offer lower copays based on a sliding fee scale as well to families to help serve them better. Next slide. So I'll just
I think before we move into, sorry about that. I think before we move into budget constraints, we did have a question. I think it was from North Dakota. If we think back to the administrative costs, I believe it was slide 20 is when the question came in, and I can go ahead and go back quickly. I think this is a pretty easy question we can address quickly. Is it 5% for all 5 categories total, or is it 5% for each category? That's the question from North Dakota.
Yeah, and it's 5% for all 5 categories total. These are all just examples of administrative spending.
Perfect. Yep. And Amanda says, thank you.
Great.
Any other questions from the attendees here before we move on? Go ahead and get us back to where we need to be in the slide. All right, I don't see any questions or hand raised, so back to you, Anne. Thank you.
Sure. Okay, we can go to the next slide, Leanne. So the purpose of this section is really to talk about budget constraints and competing budget priorities when you have limited funding available to your lead agency. And there's 3 categories we're going to cover: reimbursement rates, eligibility levels, and copays. And the idea that we would just want to get across here is that if you make a change in one of these areas, there's definitely the potential to have an impact in other areas of your budget as well. Next slide, please. So for eligibility levels, this is really your entrance and exit levels for families in your program. We have rates, which are your reimbursement rates that you pay providers, or you may provide a voucher to providers for. And we also have copays, which is the amount of money that's charged to families in addition to the benefits they receive. Next slide, please. So we have 2 examples here. The one on the left, if you want to serve more families and increase your eligibility levels, it's just important to keep in mind that this may impact your reimbursement rates that you can pay. You may need to pay lower reimbursement rates or increase your copay to offset the increase in the number of families that you're serving. For the right side example, you can see that if you increase your reimbursement rates, you may serve less families, and you may also have to increase your copays on families as well. So we really just want to keep in mind here that a change in one of these areas actually can have a significant impact on the other areas of your budget. And I wanted to mention here that the Subsidy Center is currently working on a tool that will help states understand how making changes in these areas will basically make a bottom line impact to their budget. And we are looking for states and territories that would be interested in testing out this tool fairly soon. And so if that's something that you're interested in, you could either raise your hand now or put it in the question section, or we also have a section on our evaluation form for people who are interested as well. Okay, and then the last thing I wanted to mention here is that it is important to keep in mind what administrative data as well as research that you have available to you to really make a case for funding for your program and to help you prioritize the limited funding that you do have. So when we're talking about administrative data, this could be state and federal CCDF data reports that can help tell a story about your program and the people that you're serving. Many of the reports that Leanne mentioned earlier, such as the 801, the 696, and the Quality Progress Report, would all be helpful for decision makers to get a summary of, to understand what you're doing with your dollars. Also, if you're trying to make a case for additional funding, it's really important to look at areas where you have research that supports the outcomes of your program. So you can look at evidence-based research or best practice research that exists on your program. And you can also consider doing a cost-benefit analysis. So if you want to show for every dollar that you put in your program, the cost that you may avoid or save the state, this is another tool that you can use to really make a good case for your program. For example, for every dollar that you put into your CCDF program, you may avoid X in unemployment costs. And that's really helpful for decision makers to think about as well when they're prioritizing limited funding. So one more note on this. Again, the Subsidy Center is developing a training right now for states on how to make a case for their CCDF program to their budget offices, whether it's their department budget office or their governor's office or the legislature, to really help you figure out how to talk about your program in a way that lends support to your program. So if this is something you're interested in participating in, again, you could either raise your hand now, or we have a place on our evaluation form where you can indicate this as well.
Thank you,
and with that,
Anne.
I wanted to see, yeah, are there any other questions that come up before we move on?
I don't see any questions in the questions panel. For the hand raise, we did have one volunteer from Virgin Islands for the budgeting tool, but I don't see any hand raised for the, how to talk with your budget office or legislators. But again, we'll have an evaluation will pop up following the webinar. And if that's something that you're interested in learning more about, like Ann said, you can just mention it in the evaluation and we'll reach back out to you. Oh, there we go. We do have one hand raised. Amy, thank you so much. All right, so I guess we'll keep on moving along. And again, if you all should happen to think of questions as we're talking, you can go ahead and type it into the questions panel, and then we'll make sure we pause and come back to your question. All right, so now we're going to talk through at a pretty high level some other considerations that Ann didn't mention that might impact your CCDF budget. So we're going to talk through equal access, quality childcare, as well as the cliff effect. And I'm going to start with equal access. So for this one, we start with highlighting some of the requirements. And then when we think of our CCDF eligible families, state or territory payment rates for child care services must be sufficient to ensure equal access to services comparable to those families that are not eligible to receive CCDF. Also, market rate surveys, they must be conducted regularly to ensure that CCDF providers are being paid at a rate that's comparable to the local market. So if we keep, those two things in mind, families may not be able to choose quality providers if payment rates are too low. And if we tie this one back to budget considerations, in those triangles that Ann shared, any adjustments made to payment rates to meet equal access requirements could impact the CCDF budget and could certainly impact another area of CCDF, such as eligibility or copay. Another fiscal consideration is quality childcare and increasing access. So all of these boxes here on the slide provide ways to increase access to quality providers for our CCDF families. And again, kind of same theme here, making any of these changes to your program could certainly impact your budget. So if I just pick out one example here, say you get a push from your governor's office to focus on educating parents on the benefits of selecting quality childcare providers. And what does quality look like? So you maybe need to spend some additional funds that you really weren't, budgeting for at the start of your fiscal year. So how is that now going to impact your CCDF budget? The final additional consideration that we just wanted to talk through related to fiscal management is mitigating the cliff effect. So one of the most significant barriers to self-sufficiency for our low-income families is the cliff effect. So, and that's where a family becomes ineligible for childcare due to an increase in their income. But that income increase is not at a rate that allows the family to be self-sufficient. So we just, threw out two potential strategies to combat the cliff effect. The first, for families in graduated phase-out, creating a gradual reduction of benefits as the parent salary increases, and that would be through the sliding fee scale. So as a parent's income increases, the lead agency will also increase the family copayment amount. But again, just remember that copay can only be increased during that graduated phase-out period. A second strategy that we identified is for a lead agency to reconsider what qualifies as countable income for families. So an example of this one, a lead agency could disregard specific income that's received, and maybe that's TANF, SSI, a lump sum childcare support payment. There's a whole list of different incomes that some lead agencies are just not counting as part of family income. Moving into our next section here, we wanted to talk through guidance for new state administrators as well as succession planning. Some of these topics that might go hand in hand. So for the next couple slides, we want to talk through both succession planning and supporting the onboarding of a new CCDF administrator. So one thought that we lay out here for consideration is to consider mapping out and documenting where CCDF resources can be found and who's responsible for the different activities related to CCDF. So as a new state administrator, who can you go to find subsidy data and information related to your program? So we are encouraging to find your program's institutional knowledge. Who are your budget personnel? So who are those persons that are responsible for submitting those federal budget reports? Who maybe approves the payments that are going out to subsidy recipients? And then moving over to the program staff, who's responsible for grants and contracts? Who's responsible for program integrity and fraud prevention, the error rate or improper payment reviews, writing and implementing policy? There's a whole list of activities related to CCDF, and one of the things we just want to kind of point out or draw attention to is ensuring that as a CCDF administrator, you know who in your program is your go-to person for each of these activities. So who are those subject matter experts within your office? So a helpful succession planning resource for lead agencies, it may outline the roles and responsibilities of CCDF staff, the state's CCDF structure, a description of projects and programs that CCDF staff oversee, and then key interagency and community-based partnerships for CCDF and early childhood-related initiatives. So one of the things that Anne has created recently is a succession planning contact list that is available in the handouts within GoToWebinar, and I also emailed it out a little bit, about an hour before the webinar, to those that had registered by this morning. But we want to walk through that tool for you today, and hopefully you all will find it beneficial, and it's certainly editable, so you can make it fit your program. I'm going to go ahead and pull up the tool, and I'll go ahead and let Anne walk through it for us.
Sounds good. Okay, so as Leanne just mentioned, this tool is really meant to help you map out who your key contacts are, both within and external to your lead agencies related to the CCDF program. And it contains 4 areas, and we've put, both in the instruction sheets and in the different tabs, we put several examples of staff that you may need to reach out to for information on the CCDF program. The tool is meant to be totally customizable. We just put in common examples. So Leanne, if you could go to the Department Leadership tab. For this one, this is Department Leadership if your lead agency is housed in a larger department or agency. So for example, you may be within Human or Social Services, and you might have another layer of leadership that you need to contact, such as your department director or your budget staff or your grants manager for CCDF. And so this tab here is for that broader department that you work within. For the lead agency leadership tab, this one is your actual lead agency team. So perhaps your financial manager or your policy manager, you want to know who handles those sorts of things, your program integrity lead, or your criminal background checks lead. So you can again customize this. We've put job responsibilities as an example, so you can get some ideas, and we also have more in the instructions tab as well. Then for other related staff, these are staff that are outside of your agency, but that you'll likely interact with on a regular basis. So it could be your governor's office analyst that works on CCDF, or maybe your legislative analyst. It's definitely, for when you work with other programs such as TANF or workforce programs, you'll have people there that you'll want to contact and reach out to. And then there's other programs like the Child and Adult Care Food Program as well that you may work with. And so it's really just to help you think about who outside of your organization do you need to reach for additional information. And then on the last tab, we have early childhood IT systems. And this is where you can lay out the different IT systems that hold data on your CCDF program. So it's really going to vary based on your state or your territory or your tribe, but you may have a payment system or an eligibility system that you want to access and get data from. And it's good to know what those different systems do and who the administrators are that you should contact. So that's what this tab is for here. And that is
Great.
The succession planning tool overall. We'll send out a final version of this after the webinar.
Yes, great. Thank you, Anne. And I did, there's one question that came in from Ruby. She didn't receive the attachments. Just for everyone on the call today, in case you didn't receive the attachments earlier or for some reason can't download the handouts, we will make sure that this tool is sent out to everyone on the call today. So if I can get us back to our slide deck, see if there are any other questions so far before we kind of start wrapping up. I see a couple hands raised. Meredith from New York, Meredith Bastiani. I'm going to go ahead and unmute you and see if you have a question for us. Meredith from New York, do you have a question? I see your hands raised. Oh, and Meredith put her hand down. Okay, and we have one. Oh, I think that might be a leftover. Okay, No hands raised and no questions. Okay, so we're going to keep on going here. And as I started to say, as we wrap up, we wanted to share some examples of some of the more frequent TA requests that the Subsidy Center receives related to fiscal accountability and budget considerations. And those are mostly related to eligibility levels and copay scales. So if a state administrator would like to make a change to eligibility levels or see examples of other states' copayment scales, they can come to the Subsidy Center for TA. Or what do other states' copayment scales look like? That's another frequent one. And how can I get examples? So like I mentioned, these are TA areas that the Subsidy Center can help with. And you'll start by reaching out to your regional office or your state system specialist. And then they'll put you in touch with your NICSIA or your Subsidy Center liaison. And will help you out with whatever's needed related to copay, fiscal, eligibility levels. Whole gamut there. And some useful links. We thought we would just share 2 useful links that can be used, and they provide a variety of TA resources. So the first one there is the Subsidy Center's webpage. And then the second one that we found very useful was the CCDF resource guide. And that one can be found on OCC's webpage. So what's next as far as the program integrity areas of CCDF and technical assistance? So as Ann mentioned, we do have some resources in the works. We have the CCDF budget tool, and that's in Excel. And then we're working on 2 small group or one-on-one opportunities, how to work with your budget office and how to talk to your legislators. And again, as Ann mentioned, if you would like to, be involved in the development of any of these tools, or, you would like to receive some TA on working with your budget office or legislators to help maximize CCDF funds, you can throw that in your evaluation, and we'll be sure to reach out following the webinar to connect and learn more about what your state's needs might be. We also continue to develop our fraud toolkit. We do hope to release the detection section of the fraud toolkit within the next couple weeks, and then enforcement we expect to be released later this summer. Our next program integrity webinar is scheduled for September 10th, and at this time we do plan to dig back into fraud strategies, including appeal processes, preparing for the hearing, recovery, and sanctions. Again, that's kind of what we're planning on right now, but feel free to use the evaluation to let us know if there's other program integrity topics that you would like to learn more about. Or maybe, today's webinar was pretty high level, the basics of CCDF fiscal fundamentals. If you want us to dig in a little bit more, feel free to let us know that as well. We love hearing your feedback. We want these webinars to be beneficial to you. So again, please feel free to complete that evaluation, and you can help drive the future program integrity webinars. Before we wrap up, are there any other questions? Any topics that you all would like to discuss a little bit? We have some time built into the end of the webinar for discussion. But if we don't hear anything, we'll go ahead and give you 30 minutes back in your day, and we'll wrap it up. I see no questions and no hands raised. Maybe everybody's still in vacation mode from the 3-day weekend. Ann, anything else you'd like to add?
I don't think so.
Okay.
Thank you all for your time.
Everyone. Yes, thank you for your time this afternoon, and we look forward to seeing your evaluation feedback. Thanks so much.